So I'm going to talk to you all very briefly about the cardiovascular agents that I've asked you to study. In your drug classification D2L course module, you were provided with the following list. And in this list, there are 67 drugs for you to study. Previously, what I've asked for you all to study with respect to the drugs are the brand names, the generic, the dosage form that it comes available, as well as any kind of the indication and then the special precautions. However, there are 67 drugs to study for the cardiovascular, and I feel that that may be overwhelming, and for me, to be honest with you, I think it's more important to just know the brand, the generic, and what category these drugs fit into. What I have done for you all is I've prepared a different study guide that I will be sending to all of you. And in this study guide, I wanted you all to have a better understanding of what these categories even mean and how these drugs work. So I created this study guide for you all so that you can understand, for example, that there are various cardiovascular conditions that a person can have. An example of a condition could be angina. And simply what angina means is it's a type of pain that someone can have in the chest, and what's happening is that for some reason, could be for a blockage, that there has been reduced blood flow to the heart. And so to kind of understand the study guide, I wanted you to see that for somebody who's having chest pain, they could be prescribed either beta blockers, nitrates, or calcium channel blockers. Okay? And in those categories, beta blockers, these are the various types of drugs that could be given, and these are the brand and generic names. I also felt that it'd be important for you to understand what exactly a beta blocker is. Beta blocker is basically, it's just telling you what a type of drug class that it is in. And what it's doing is reducing the workload on the heart, and it helps it make the heart beat more regularly. When it's doing this, it's helping protect the heart so that the person doesn't experience a second heart attack. And these are the types of drugs that could be given in the event that a person has already suffered from an initial heart attack. What are nitrates? So what nitrates do is they dilate, or what we also could say is open up the arteries to the heart. And when you do this, you're helping increase blood flow to the heart, and it helps relieve that chest pain that a person could be experiencing in that pressure. And then these are the 3 drugs from your list that fit into that category. For calcium channel blockers, what that means is that it's blocking or preventing calcium from entering into the cell of the heart and blood vessel walls. When you do that, you actually help reduce the blood pressure. Calcium channel blockers could also be called calcium antagonists. And what it's also doing is it relaxes and it widens those blood vessels, so that way there's not as much stress on the muscle cells in that arterial wall. So from the drugs that I've given you, these are the 4 medications that I've asked for you to memorize. So I just wanted you all to have a better understanding of the categories. So for the cardiovascular agents, please make sure that you study this study guide. All you're going to be asked is to know the brand, the generic, and the drug class that they are in. And that would really, for me, be the most important. But I'm going to scroll down to the hypertension area. The hypertensive drugs, or antihypertensive drugs, are helping the person to reduce their blood pressure. Now, in pharmacotherapy and disease process, you will be asked to memorize the long list of antihypertensives and to know which categories they go into. An example, because I'm not going to ask you to do that for this particular class, but an example could be for Norvasc. Norvasc is a calcium channel blocker. Atenolol is a beta blocker. Your Carvedal is a beta blocker. Clonidine is actually it's actually a central nervous system drug, but it can actually also help in reducing blood pressure. Your cardizem is a calcium channel blocker, and I mean the list goes on, but it really, for me, for this particular drug, there's a lot of these antihypertensives. So all I want you to know is the brand, generic, and the fact that they are antihypertensives. And you may be asked, what is an antihypertensive? And in that case, you would know that these particular drugs can help reduce someone's blood pressure. Okay, so to go back up here, because I want to make sure everyone is clear. So if I ask you questions, I could ask you a question on your quiz for cardiovascular on what does angina mean, or what is a beta blocker. I could ask you what is the brand or the generic names. Okay, I could ask you about nitrates. I could ask you what calcium channel blockers are. And the next one is the antiarrhythmic agent. So antiarrhythmics are drugs that are used to treat abnormal heart rhythms resulting from irregular electrical activity of the heart. Do note that I did state that there's two different types of antiarrhythmic agents, but right now you're only being asked to memorize two of the potassium channel blockers. For the purpose of this quiz, you only need to know that Lanoxin and Cordarone are antiarrhythmic agents. I'm not going to ask you as to whether they were potassium channel blockers or membrane stabilizing agents. Okay. For the next category, for congestive heart failure, I'm sure all of you have heard that term before, and you may wonder, what exactly does that mean, right? Because when we hear congestive or the word congested, we usually think of just the respiratory system. We may think of the upper or lower respiratory areas. But I think it's important for you to understand that what congestive heart failure means is the fact that there is a buildup of fluid, and it could be in the arms, legs, ankles, feet, lungs, or other organs. And what happens is the body becomes what they call congested, or we call it congestive heart failure is the term. And there are different types of drugs, categories of drugs that could be prescribed. So the NitroPress was an example of one, but that's not on it's not on your list. So I'm going to make sure I delete that so that you don't have to I don't want you to get confused. But just know that there are something that's called vasodilators, ACE inhibitors, and diuretics that could be prescribed for somebody who has CHF or congested heart failure. So for the ACE inhibitors, I wanted you to understand what that actually means. And basically, it's just helping the enzyme ACE. It decreases its activity. By doing that, it actually helps dilate or increase the blood flow, and then it will in essence reduce the blood pressure. And then here are the drugs that you would need to know. So for these particular drugs, you don't need to know necessarily for this quiz that it's used for congestive heart failure. Just know that it is an ACE inhibitor. Okay. The reason why I put this here is because I think it's important for cardiovascular drugs for you to know what a CHF is. Okay. All right. The next list of drugs, you need to know that these are diuretics. When we skip down here, take note of this. So all you need to know as far as these drugs is that all of these drugs are antihypertensives. When it comes to anticoagulant drugs, that's what you would need to know for these. That these are antiplatelet drugs. That all of these particular drugs here are anti-hyperlipidemic, which what those means are that they are for cholesterol. And then these are your hematological agents. So to do a quick recap, for these following drugs, you want to make sure that you know that these are beta blockers. Okay. For the next set, that these are nitrates, that these are calcium channel blockers right here, that these particular drugs are antiarrhythmic, okay? For these particular drugs, this next set, that these are ACE inhibitors, that these are diuretics, that these are antihypertensives, anticoagulants, antiplatelet, stroke, and then your anti-hyperlipidemic or cholesterol, and hematological agents, okay? So that concludes the short, sweet, and to the point lecture over cardiovascular drugs. If you have questions, please do not hesitate to email me, and I'll be more than happy to answer any questions that you may have. Thank you.